Okay, so this next mnemonic is to help you remember the nursing care involved with patients on traction. So traction is something that maybe you'll see an orthopedic patient or maybe a patient in cervical traction to maintain the appropriate amount of tension on a limb. So there's quite a bit that nurses kind of have to be monitoring for these patients. As you can imagine, it's a lot of stuff going on. So traction is the mnemonic, the word TRACTION. So T for temperature, both of the extremity and an overall temperature. So you want to assess, let's say it's their right leg. You want to feel the leg and feel if it feels warm. But then you also need to take a body temperature to see if they're febrile. The R is for ropes hang freely. You want to make sure that nothing is impeding the ropes because that can affect the amount of traction that is applied. And the physician will specify how much traction. So if you have something affecting the ropes, that can, give them the inappropriate amount of traction. The A is for alignment. You want to make sure that the alignment is checked appropriately and that can just cause a whole host of problems if they're not aligned appropriately. C, circulation check. You want to do your 5 Ps. That's another mnemonic. The pain, paralysis, etc. So checking all of the extremity that's affected, you want to make sure that it's getting appropriate circulation. The next T is for type and location of fracture. So you want to know where the fracture is so that you can provide appropriate education and appropriate care, nursing care when you're doing other things like turning and bathing and whatnot. I, increase fluid intake. We want to make sure that they are appropriately hydrated to facilitate healing. O, overhead trapeze. So if the patient is in traction for, say, their leg, they can utilize an overhead trapeze to reposition themselves, which is very, very helpful. And utilizing that instead of using maybe their arms on the side rails or something, which could affect the traction. And then the last letter N is no weights on the bed or floor. So if you have the weights for the traction that are on the bed or the floor, it can really affect the amount of traction that is applied because they can be moved easily and go from weight or just the right amount to nowhere near enough or way too much in an instant, and that can result in some severe complications. So those are the things you want to remember of your patient that is in traction. Again, the mnemonic is the word traction, and T, temperature, R, ropes hang freely, A, alignment, C, circulation check, T, type and location of fracture, I, increase fluid intake, O, overhead trapeze, and N, no weights on the floor or bed. So I'm going to go through that one more time. It's traction, T for temperature, R, ropes hang freely, A, alignment, C, circulation check, T, type and location of fracture, I, increase fluid intake, O, overhead trapeze, and N, no weights on the bed or floor.
This has been another episode of the Nursing Mnemonics podcast by NRSNG.com with your host, Katie Kleber, RN, CCRN. To grab all of our nursing cheat sheets, head over to NRSNG.com/freebies. That's NRSNG.com/freebies. Thank you so much for being here today. We love you guys. We thank you so much. We want to see you guys succeed. Listen, we're all in this together. Now go out and be your best self today. Happy nursing.